People in the northern Idlib area have been living in constant danger for over 18 months now, leaving them destitute and with no access to healthcare. Local solidarity is helping to run a secret healthcare facility. An MSF team offered its support.
We went
to the area to assess the people's needs. Then we started to support the medical health posts, offering medical supplies and helping them with training, because lots of people are acting as nurses because it's a war situation and there's nobody else to do it. We've also been trying to set up an ambulance system to evacuate people from the area.
A month ago, another team went to evaluate needs in Deir ez-Zor, a remote region in the east of Syria also ravaged by the conflict. The team saw empty hospitals that have been subjected to intense shelling. There too, Syrians have rallied round to convert this old school into a makeshift hospital. The situation in both these areas is very alarming, and the few health workers present have to make do with just the bare minimum. Bedaquiline is a new drug that has just been approved by the US Food and Drug Administration. Tuberculosis has developed an increasing resistance to the drugs normally used to combat it, making it a difficult disease to treat. It takes 2 years to treat drug-resistant TB. With up to 20 pills a day, 8 months of daily injections and severe side effects, treatment is complicated and too few people receive it. This drug presents new opportunities.
Bedaquiline gives us a real potential to have a new regime with less side effects, more effective, shorter. This in turn will give more access to treatment for drug-resistant tuberculosis, which today is very neglected. Of course, there's still a lot of questions to be answered. How to best use this drug? What are the side effects? Now it's up to all actors to work together to ensure that it's used in a responsible way and to ensure that everybody has access to this drug. Everybody in all countries around the world, even those in the poorest countries.
A treatment protocol using this new drug in combination with other drugs needs to be established, but bedaquiline could allow the scaling up of treatment for drug-resistant tuberculosis. In 2011, more than 300,000 new cases were reported, but only 19% were treated.
It means also that we need to secure public funding to do the R&D, but R&D is so expensive. I think that
researchers, global health experts and institutional donors met for a 2-day conference. They examined the progress and the shortcomings in the medical R&D initiatives in the field of neglected diseases. Only 4 out of the 336 new treatments developed over the last 10 years have been for the treatment of neglected diseases, effectively excluding millions of patients from the benefits of medical advances. MSF put forward this analysis during the international conference before going on to make its recommendations.
It's clear from MSF's work in the field that we are still lacking the tools we need, both diagnostic and therapeutic, to treat many of the conditions that we encounter. Today's vaccines have specific cold chain requirements, which poses a really tough logistical challenge, and these vaccines need to be administered in several doses. So what we at MSF would like is a much less complex tool, a tool that is adapted to our working environment and affords better immunization coverage to prevent childhood killer diseases.
22 million children still do not receive the vaccinations they need. And if tuberculosis and tropical diseases such as Chagas are so-called neglected diseases, the fact remains that they are responsible for more than 10% of deaths worldwide. The roads are passable again. The end of the rainy season saw the arrival of new refugees, mainly women and children at Yida camp. Often very weak, they are able to receive health care here. In August, MSF increased its medical capacity to reduce the very high mortality rate in the camp. There are now 80 beds at the MSF hospital, and the medical teams give consultations in several different locations. Although the situation has stabilised, the teams are watching closely in case of another massive influx of people.
We've maintained the medical capacity we put in place during the emergency. We've got tents that we aren't using right now, but we're leaving them up for a few more weeks while we wait to see if there's an increase in admissions and people needing medical care.
Malnutrition is one of the conditions treated in the camp. While the infant mortality rate has fallen sharply, the number of children suffering from malnutrition remains high. Between the end of July and mid-November, over 1,900 malnourished children were treated as outpatients, 491 were hospitalised. Over 100,000 displaced people are living in camps around Goma in North Kivu. Conditions are extremely harsh. Several fixed vaccination points have been set up to immunise children, like this one in Mugunga 1 camp.
We're vaccinating to prevent a measles epidemic, which can occur when people are living in crowded conditions in a camp.
Measles can lead to diarrhoea, pneumonia and blindness. It is one of the main causes of death in children. The virus is also highly contagious. It takes just a sneeze to spread it. So the community health workers ask all the mothers to get their children immunised. The campaign also provides the opportunity to screen children for malnutrition. Their nutritional status is assessed and when necessary they are referred to a health centre for treatment. The objective of the campaign is to immunise 28,000 children between the ages of 6 months and 15 years.